It's really such a pleasure to be here with all of you today and to speak to you about something that's very important to me and also quite personal. I want to explain to you why I believe the overturning of Roe versus Wade and the systemic removal of choices in healthcare we are all seeing today will hurt not only the women and the babies it sets out to protect, but it will ultimately cause our healthcare system, our social infrastructure and fabric, and even some of our families to unravel. I really don't say these things lightly. I am Dr. Claire Putnam. I'm an obstetrician and gynecologist. I have worked and done abortions and done healthcare for women for about 20 years, a little more. Abortion is a very, very, very small part of what I do. Interestingly, I have done abortions for women of all walks of life and in many different settings. I have even on several occasions refused to do abortions. I know that most of the time I and my patients, we are very sad about this. Abortion is a loss, and I know that there can be, in many ways, a better way and a different route, a different outcome, and that we didn't need to go down this path together. There's really no joy in abortion, no celebration, and often this undercurrent of sadness and loss, and also a big relief. The relief is there because we're not committed to bringing in a life into this world that would bring suffering. Sure. I was told to bring it down. I'm not loud enough?
You're loud enough in here, but what's going on
is not. Okay. Sorry. I do stand up, by the way, and I play poker, so anybody who wants to play poker with me, let me know. I think our story today really touched me. Thank you for reading that story with the children. I was sorry that there were only 3 children here today. I feel like we need more children to come into this fold. We all need to bring children into this world. We need to bring children in, though, who are wanted and that are cared for. Women who have abortions, most of them already have children. People don't know that. But the majority of women who are having abortions already have 1, 2, or 3 children. And another child to them is something that they cannot handle. They cannot care for the way that they want to. They are torn when they come to see me. They say, I don't want to do this, but I can't afford. I don't have enough support and love to raise another child. They're wonderful mothers, most of them, but they're struggling. Most women who are seeking abortions are living in poverty, and their children too. I don't think many of us really know what poverty is. I don't think we've put ourselves into the shoes of poverty and lived that way for a day or a month. And to add on the burden of another child at a time when you are struggling to provide for your own child, or 2 or 3, is a terrible burden. I know that for many the answer is that that life is sacred and that we should have that life in this world and that abortion is wrong. And I, like all of the people who feel that way, would love to have that person not be in that situation. I too want to lower and end the abortion rate. Not end it, because there are so many abortions that I do that are so important that we continue to do, especially in a world that is changing in a direction of having less availability of resources and less availability of a good life for so many. There's so many people we all see who are struggling here in this county, in this state, in this nation, and beyond our nation's doors. One of my dear patients has had 4 miscarriages when she came to see me. Actually, she had gone through 4 of them with me. She found out she was pregnant again. And we followed her pregnancy very carefully. She was older and had found really the man of her dreams after many years struggling even with a cancer diagnosis and recovery. At 11 weeks, my patient and I, we did a fetal DNA test on the embryo to see if it was a normal, healthy pregnancy. It was the first time we had seen a heartbeat together in her embryo. It was so joyous. They were so excited. This was a wanted and loved pregnancy with so much hope. But we have this technology now where we can go in and we can check and say, is this pregnancy healthy or is it not? And we can check it very early. It's a modern miracle these days. This was the furthest that she had gotten in pregnancy. But the test returned with a severe chromosomal abnormality called trisomy 13. You can Google it if you want to when you go home. You can see what it's like to have a child with trisomy 13. And you can ask yourself, how would that affect you and your loved ones to have a baby with that? Before Roe was overturned, every woman had a choice. If they had that information, they could say, I don't want to bring this life in, and I want to start over. It's a moment of great sadness. It's a very hard decision. And the decision is not always to end that life, and I respect that, right? I have seen women who said, no, this is what God wanted for me, and I will do what God has wished for me. And I respect that. I have also seen women who say to me, I cannot consciously bring this life in, knowing that this life will not be a life worth living. And I respect that. But for many women today, there isn't an option for trisomy 13. And in our own state, we were saying that babies, once you get past a certain gestational age, you cannot have an abortion. And with LR 131, which was narrowly defeated, that would have required us as doctors to have those babies be born. These babies deserve love when they're born, and they deserve some care. But they also, you have to understand the amount of care that it takes to raise a child and the amount of resources that are used to take care of that child are immense. And by taking care of that child, we have to look at it as a either or. How are we going to use our resources going forward in healthcare? Because not everyone can have everything. We saw with COVID, we just don't have enough. And COVID has left us with major deficits and the lack of care in our communities throughout the nation. We do not have enough ventilators. We do not have enough doctors like me. We don't have nurses to step in, and we don't have enough facilities to take care of the needs that we are already here. My patient wanted an abortion when she had the diagnosis of trisomy 13. And I'm trained to do this, and I've done this. We got a secondary confirmation with an amniocentesis because we don't want to make a mistake and do something to a baby that's normal. But then I said, I will do this for you. But the problem is that the misunderstanding in our communities and in our world here in Montana and elsewhere was that I was not allowed to do that, even though I'm trained. I went to Livingston and I said, I will take her here. I will do it safely. I make sure that the nurses and the team that are with me are all in agreement. I don't want to disrespect someone who says, I won't be a participant in this. I respect that. But the hospital said, no, we don't do that here. And Bozeman said, we don't do that here. And the number of places that say we won't do this here is growing, even though it's legal. And in many cases, it's the right thing to do. This hurts me a lot. It's making me struggle. I called many places around Montana, and I was able to find a spot for her in Missoula. And I sent her records there, and I sent her off with a big hug and said, you'll be okay. I'm sorry I'm not going to be there with you. And she had an abortion, and she came back. And I'm so happy to report today that she is pregnant. She had to use donor eggs because that was the way to solve her miscarriages and these problems. But she's pregnant today. So I just really wanted to share that with you as a joy, hopeful joy. What I want you to think about is when we've overturned Roe versus Wade last June, many doctors have chosen to leave medicine. And very few doctors have chosen to speak up about it. In our book today, Paul said, dare to speak when others won't. That's kind of my mantra, unfortunately. Get in a lot of trouble speaking. But it's so important for us to speak up with our own voices and to take what you learn today and from others that you understand and to tell it to someone else who may not understand. And to share that. It doesn't help to say, I think that person doesn't know, and so I'm not going to bother to talk to them, or they have a set belief. I'm hoping that by more of us speaking up and by me coming into places like this, I feel like you're all my friends, but coming into different spaces and talking, even at the poker table, which is what I do, to people who don't always see eye to eye with me, that I make small bridges and small rivulets and change small minds. Smally. That's not a real word, kids. Okay. Since we overturned Roe, we've also been plagued with a rise in our global warming and in the need, the urgency for us to think about our resources. And I know it seems like apples and oranges, but these are all really connected. Doctors are leaving healthcare because of Roe, doctors like me. And the thought has crossed my mind. I was asked today, are you going to retire? I'm like, I wish, but I can't. But doctors are leaving, and they're leaving the states with the greatest burden. And I don't blame them at all. How can I go to a place like Texas and be a doctor and care for women when I can't give them the healthcare options that they need? And if I somehow do something that is the right thing to do, someone who's coming in, losing a pregnancy that will not make it, and losing a lot of blood, which happens frequently, and I can't step in and evacuate that pregnancy to save her life, and I'm faced with, I either do that or I'm put on trial, in jail, fined, my medical license is taken away. How do I make that choice? I mean, I know what choice I would make. There's no way I'm going to let someone die in front of me. I didn't go to medical school to let people die on me, and no one's died on me. I'm not going to let that happen. But it happens, and it's happening more now. I don't know how we can have a healthcare system without OBGYN physicians. But they're leaving. We are leaving. Every day I'm faced with calls and texts and emails asking me to fill the great need that is present and has been present since before COVID. Before COVID, we had not enough doctors and huge maternal health care deserts. Deserts where women go in to get health care and there aren't people who can do it, who can't give them birth control, who can't give them good prenatal care, and who can't really safely deliver babies. This affects especially the poor, the disenfranchised, minorities, Black women. We have a call out in our American College of Obstetricians and Gynecologists to actually rise up and try and change this healthcare inequity. This was happening before COVID, but the data and the truth is it's only getting worse, and it will get even worse. I'm asked every day to come to Texas and Oklahoma and Louisiana and Alabama and now Tennessee and Ohio and Indiana. I can name them. Wyoming, Idaho, South Dakota, Montana even. It's funny because I am in Montana. They don't seem to want me. But I'm asked to go. And can I go for a week? Can I go for a month? Can I move there? Will you stay here? Will you please come and fill our gaps? But I cannot. I have a lot of PTSD in me, in case you didn't know. It's really hard to do this job, to sit with crying patients and to have women die occasionally on you. It's a very hard job. It's an intersection in OBGYN between morals and values and life and joy and heartbreak and lawsuits for many and incredible financial burdens and long hours and sleepless nights. But I can't go into a community, even though there's a great need, where I can be punished for what I do or the right thing to do. I can't do it. I also don't know what can and can't be done, what is legal and what is not. I bet the politicians who wrote these laws don't even know. I know they don't know. I mean, we should have a quiz show for them. Let me line them all up. I'll be the host. I just feel like you can't ask me to go there when I don't know what I can and can't do. And I'm really bad at having other people tell me what to do anyway. So I'm going to do what I think is right and what's right for the patient and what we decide is right, because that's what I was taught and that's what I believe in. We have choices right now, and we have voices. Those rhyme. I like that. We have choices about which direction we're going to go after Roe. And we have choices about which way are we going to go in the world. One thing I know is that the children who are born of women who have sought abortion and were not able to get it, these are not children who lead necessarily happy lives, even though they are physically healthy in many cases. A large number of them are growing up in severe poverty and have crying. Is that a timer? Like 2 minutes left? Or is that just the wind chill? Wind chill factor. Okay. A lot of these children we know go into foster care. About 25% is an estimate. And of those who go into foster care, it's about a 25% risk of going into somehow either the juvenile detention system or into the prison system at some point. learning disabilities, and a cycle of poverty. I think that's suffering personally. The other side has made a big point of saying that I am a baby killer. I've been labeled that. And I say, you have no idea. I do not kill babies. In fact, I've saved so many babies along the way. And what I want them to know, and what I want people to really understand, is that babies, yes, we can all work towards having healthy babies and healthy pregnancies, but the answer is not banning abortions. The answer that I see is in expanding, first of all, education and knowledge and support for women and families. We need to educate women about pregnancy, starting at a very young age, and about the responsibility of sexuality, and to make the choices that are right for them. We need to do sex education. We also need to bolster the support of women so that the abuses that are happening to approximately 20% of teenagers and young women in one form or another go down. We can do that by supporting both young women, young men, family programs, and helping. My dream is that we don't have any unwanted and unplanned pregnancies. But we're moving in the opposite direction. By taking away the education of women, banning books, banning doctors like me or other health educators from going in and saying, this is your body, this is what it can do, these are the things to take care of yourself. It doesn't help. It leads to more pregnancies. The other thing we are doing, since we've overturned Roe versus Wade, and doctors like me are disappearing, and clinics are shutting down, is that we have dropped our access for women for care. And now more women are going to be going off of Medicaid. This one small amount of health care and premiums that allowed them to go get the services that they need are being taken away, disproportionately so from women and children. It bothers me a lot as an OBGYN that we are trained to talk and do birth control for women, but there are many of us who don't give birth control. I bet that's a surprise to you. I know I see eyebrows going, what is she saying? The truth is that a lot of situations now, in certain healthcare environments, you're not really supposed to talk about birth control. Or, if you do, you can't offer all the types. Or you can say, you can have this type of birth control, wink, wink, because you're having heavy bleeding, wink, wink. Not because, hey, this is reliable birth control that's in your body for 5 years and will decrease your risk of unintended pregnancy by 99.5% and is reversible. That's not said. So many women in our communities and in our state and in our nation, as they go to these healthcare entities where they don't get choices of birth control or education about it. They also see doctors who are a little different than me. They may be OBGYNs, but they personally don't feel that birth control should be discussed with all of their patients. And that's hard for me to understand because birth control is health care. And birth control is important for helping us have the pregnancies that we want to have eventually, and to not have the ones that won't work out. You see, I'm sticking to my script pretty well. Most of the abortions I have done have been for women who elect to have an abortion. These are probably women who are healthy and could carry a healthy pregnancy, and that baby would be healthy. These are the ones where I feel, yes, let's all work together to help lower those rates. These are the ones that I want to help us, and I believe all of you would want us to end. The ones where women come in with a healthy pregnancy, they are healthy, they have a normal, healthy pregnancy, but they can't do it. To do this, we need not only good birth control and education, but we need access, and we also need something on the other side that's important, that's missing. What we need is we need support for women who are pregnant to be given a support framework underneath them to carry that pregnancy, and if they choose not to have that child for them, or they can't raise it, to say, here are your options for your child going forward. These are families that want your child and will raise it. And we will support you and pay you to have a healthy pregnancy and have a healthy birth. And we'll give you the health care you need. And then the birth control after. And then your baby will go to this great home. We have a hard system of adoption here that needs to be changed. It is very hard for families who can't have children to adopt. It's very expensive, and often there are faith constraints. For instance, if you are not of a specific faith, you are not eligible for this baby that's coming in through this church adoption. Or if you're not a traditional family with a man and a woman, you're not eligible. I would love to see every baby that's born come out healthy and be loved and go into a situation where it is raised, wanted. I bet you all want that too. And I want every woman to go in to her doctor when she needs to go in and say, what are my options for birth control? I need some. Or what is birth control and do I need it? These things, instead of bans, would help a lot. A lot. But now, we are faced now with a really horrible path. And I'm already seeing it here. I'm sure you've seen some of it on the news too. Women who have access, though, and the ones who make it to the headlines are the women who have the pregnancies, the abnormal pregnancies, that they can't access care, and the doctor feels like there's a gag order and can't refer them. And so they're coming forward to speak about their stories. Somehow their stories are okay. But the silence of the other thousands of women right now who are not able to make the trip across 2 or 3 or 1 border, they don't have the resources, the money, the transportation to get to another state to get taken care of. Or they learn too late. Your pregnancy's too far along. We have to, it's a bigger procedure and we can't do that anymore. I I've done abortions here in Montana, but I've sort of wound that down lately, and you may have known that. I only did abortions for women who were 12 weeks or less pregnant. And their stories are all varied, and each of their stories was important. I did mostly the medication abortion with the medication mifepristone, which you've probably heard may be taken away soon. The lawsuit is pending. The judge will be deciding on that within the next 2 weeks, they assume. And if he chooses to take that medication away, I shudder to think what will happen for all of us, because it will take it away not only in Texas where the lawsuit is occurring, but it will take it out of our armamentarium across our whole nation. This pill has changed how we do abortions in a very good way. This pill can be given up until the 11th week of pregnancy in combination with another medication, and is in many cases 97, 98, 99% effective and safe. It is discreet, and it doesn't cause infection or harm to the internal organs of the woman the way a procedure can. When we take and cut away the options for women, and then we remove the health care which is being done from women and the choices. The other thing I am seeing today in healthcare is that many women are coming and saying, I can't, I won't, and I will not, and I want to never have a child. Women are coming to me as young as 20 and 21 asking me to permanently sterilize them. Some of them have seen 2 doctors before me who said, no. But I am doing that for them after counseling. I'm saying, I respect your choice to have a sterilization. Here's the workaround, by the way, if you change your mind later, but it's a permanent. And men too. I'm going to wrap it up because I think I'm going to ramble for the rest of the day if I keep going or start crying. The last thing I want to just say before I come and socialize with you all, my favorite part of the day, is that healthcare today is under a tremendous amount of strain for all of us. We have one of the most expensive healthcare systems in the world, especially for developed nations. Yet we have some of the worst maternal outcomes for all developed nations. The other element of healthcare that is not discussed is that it's really a finite entity. It's not extensive to the point of always available and forever for everyone. And what we need to do now is think about what choices we want to make, how we want to deliver this care, and where we should put our resources going forward. And my vote and my recommendation is for us to all put as much money as we can and effort and resources into the women of this nation who lead our families and the centerfold of our families so that our next generations do the best that they can. Thank you so much for listening to me today.